Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing clinical aspect of Rasavichar and we are now in Lavan Rasa subject. Last episode, we have discussed why Lavan Rasa has got optimum Ushnavirya among all the six rasa and what is the specific quality of that Ushnavirya, and it's a rare thing in the universe where Jala and Agni Mahabhut, which are both exactly opposite in nature, have together existence at Lavan Ras. Now we will discuss the karma and Atiu Lakshana in this episode. We all know Lavan Ras is Ruchikara, so Rochan, Ushnavirya, so Dipan, Pachan, all these are very common uses we know. The very excellent use which is regarding Annava Srotas, Udara Shulagna, because of Ushna Virya, and whenever there is Ama Nirmiti, it is a very good Ampachak, Udara Shulagna, Adman, Anaha, all these symptoms are relieved very well. All these are very common uses. Hence, in many Vaishya Kalpana products which are acting on Annava you will find Lavan Ras as a major component like Hingvata Churna, Bhaskar Lavan Churna, etc. So, Rochan, Dipan, Pachan, Kurmigna, Lavan Ras is Kaphagna. So, whenever there is irritation in the throat, we always use gargles of Lavan Rasa or salt. It's a very common use. So, mainly Dipan Pachan Rochan, and because of Ushna Guna and Trishna Guna of Agni Mahabhut, it is Avarodhana Ashaka. So, whenever there is stambha anywhere in the body, we use the Lavan Rasa to relieve the obstruction. It is an excellent Shulana Dravya, and hence when there is pain in the legs, there is a common remedy that put a salt in the warm water and soak the legs in that salt contained warm water. It is a very good stambhara. So whenever there is any obstructive symptom, for example, there is a disease called as urograha, where their patient finds something, there is hard or stony heart like feeling, and it is not related to the heart always, but in that case you will find that this Lavan any Lavan is having a great use. So all these uses of Lavana are not you always all know them because there is clinically very useful. The symptoms which are more important as far as practice is concerned are Atiyog symptoms, because in many diseases you will find consumption of excessive Lavan Rasa is the main hetu in that disease. Very common disease is Khalitya, Palitya, where people will say you that there is extra salt they use or prickles like substances which has got Lavan Rasa in an excessive quantity acts as a hetu in hair fall, in graying of the hair. The second disease which is very commonly seen is high blood pressure. Now, Lavan Ras, we have seen in the first episode of Lavan Rasa, it increases secretions or water content. So, when there is excessive salt is used in the body, the blood volume is increased because of this secretion nature of the Lavan Ras, and because of that, the blood pressure is raised because heart has to pump this increased blood volume at every second. Another example out of disease where Lavan Ras used to be you should be keep in mind is Shotha. Whenever there is Shotha by any reason, you have to ask the patient to avoid the lavanda rasa because it increases the water content, oozing or secretions, and it will increase the shota. So these are the common things. Another one very common is about rakta dushtajanya vikar, anything like rash or skin disease, where especially when there is travi kushtha, lavanda ras is always you have to think about as a hetu. If you find this lavanda rasa atiu lakshana, you will find so much of variety in clinically, right from hair loss, high blood pressure, shotha, kushtha, khalitya, palitya, etc., raktapitta. So you will find that excessive consumption of lavanda rasa is hazardous. Hence, in our routine meals or when we prepare the cooking, we always add the lavanda rasa because it is ruchikara, but we always avoid the excessive of salt because of this. Hence, in Charak Samhita, Charak has told not to use three substances in excess quantity. One is pipali, other kshar, and third one is lavana. We have seen that lavanda rasa is of Jala and Agni Mahabhut, and both have their functions which are seen in the body. Of course, Agni has a little higher upper hand, so Ushna Virya is because of that. But Jala is also is a major component which is performing in the body. Hence, when there is atiyog lakshana or because of excessive consumption, you will find the lakshana of Jala Mahabhut Adhikya like Shotha also, and lakshana of Agni Mahabhut also like Amrupitta, Raktapitta, etc. So that is the reason why we have to use lavanda rasa in food in a very small quantity, and when you are using it clinically in the patients, it is very important to find whether lavanda is hetu in that particular disease first thing, and you will use that lavanda rasa as a treatment also very cautiously. So this cautioning will help to reduce the Jala Mahabhut Pradhan Vyadhi as well as Agni Mahabhuta Pradhan Vyadhi. So this is about the lavanda rasa, mainly Rakta Dushtikar, Pitta Vruddhikar, Rasa Jala Dhatu Jala Vruddhikar, and because of Tishna Ushna Guna, it increases the Agni Mahabhut also. So use in the food cautiously. Think of the lavanda rasa as a hetu in your patient, and in the treatment also think in which proportion and for how many days, in how much intensity you are going to use the lavanda kalpa. So thank you very much. We will discuss Pitta rasa in the next episode. Thank you very much.